Imagine a world where a simple cut on your finger could be deadly, where doctors are powerless against even the most mundane infections, and where the very foundations of modern medicine are crumbling. This is the alarming reality we're facing due to the growing crisis of antibiotic resistance. But here's where it gets even more concerning. The problem of resistance was predicted by doctors as early as 1954. Just a few years after antibiotics became widely available, a British doctor at the time warned that we may run clean out of effective ammunition against bacteria, and it seems his words were prophetic. More than 70 years later, the United Nations has declared antibiotic resistance one of the most urgent global health threats, with researchers estimating that it already claims over 1 million lives annually. The situation is dire, and it's essential to understand why antibiotics are so unique compared to other medicines. Unlike most drugs that work by manipulating human biology, antibiotics target bacteria directly. However, because bacteria can spread between people, the challenge of resistance becomes a social issue, akin to a scenario where taking a painkiller for your headache increases the risk that someone else might have to undergo surgery without anesthesia. This social aspect of resistance makes it more than just a technological problem. It's a complex issue that requires a multifaceted approach. But here's the part most people miss. The extraordinary power of antibiotics doesn't stem from human ingenuity alone. In fact, most antibiotics are derived from substances originally produced by bacteria and fungi, evolved over millions of years through microbial competition. This is where the comparison to fossil fuels becomes striking. Just as fossil fuels were formed from dead plants over millions of years, providing us with a seemingly limitless source of energy, antibiotics have given us a false sense of security in our battle against bacterial infections. Both have offered an illusion of cheap, miraculous, and never-ending power over nature, a promise that is now coming to an end. If we thought of antibiotics as the fossil fuels of modern medicine, might that change how we use them? Could this perspective help us find more sustainable ways to combat life-threatening infections? The era of antibiotics is less than a century old, dating back to Alexander Fleming's discovery of penicillin in 1928. Initially, penicillin was scarce and valuable, but as production increased during World War II, it became widely available and revolutionized the field of medicine. Antibiotics enabled the development of modern surgery, cancer treatment, and even factory farming, leading to a significant increase in meat consumption. However, despite their importance, antibiotics remain relatively cheap, partly because the negative consequences of their use, such as pollution and resistance, are not factored into their cost. The production and use of antibiotics lead to pollution, with recent studies showing that a significant portion of antibiotics end up in rivers, contributing to the growth of resistant bacteria in the environment. This has severe implications, especially in countries like India, where antibiotic manufacturing is a significant source of pollution. The crisis of antibiotic resistance has also exposed global inequalities, with high-income countries having benefited from the abundance of antibiotics in the past, making it challenging for them to take a moral stand against their use in other parts of the world. This dilemma is reminiscent of the situation with fossil fuels, where post-industrial nations are urging developing countries to forgo the economic benefits of cheap energy. But here's the controversial part. While we look forward to phasing out fossil fuels completely, antibiotics will always be a necessary part of medicine. The question is, how can we make their use more sustainable? One proposal is for governments to fund an international institute that develops publicly owned antibiotics, rather than relying on the private sector. Another approach is to incentivize development with generously funded prizes for antibiotic discovery. Economists have also suggested that health authorities could implement subscription models, where companies are paid a fixed amount regardless of how much of their product is used, to reduce the incentive to overuse antibiotics. Furthermore, it's essential to remember that antibiotics aren't the only solution. Supporting alternative approaches, such as vaccines, better sanitation, and public health measures, can help reduce our reliance on antibiotics. Vaccines, for instance, are vital in disease prevention and can significantly reduce the need for antibiotics. The 20th century's largest reductions in infectious disease were achieved not through antibiotics, but through improvements in sanitation and public health. Even in the 2000s, the threat of MRSA was addressed with tried and tested methods such as hand washing and cleaning protocols, rather than new antibiotics. As we move forward, it's crucial to invest in blue skies research and explore new, renewable approaches to combating infections. The era of carefree antibiotic use is behind us, and it's time to acknowledge the limits of our love affair with these miracle drugs. Just as we can no longer burn coal without considering the consequences, we must adopt a more sustainable and responsible approach to using antibiotics. The future of modern medicine depends on it. So, we must ask ourselves, are we willing to take a stand against the overuse of antibiotics, and are we prepared to invest in a more sustainable future for medicine? The answer to these questions will determine the course of our battle against antibiotic resistance, and it's essential that we encourage discussion and debate on this critical issue.